Here's my next tip and suggestion. When you do finally get to a doctor's office, like where your insurance covers it or whatnot, set up the MyChart immediately. The second they send you that, set it up, because you will get your results much faster looking at the MyChart than waiting for the doctor to then review it, to then call you, and then all the things. Set up your MyChart. When you do the MyChart, sometimes you can reach your doctor much faster through the MyChart than calling the office and leaving a message. I had to leave about 4 or 5 messages, never got responded to, but when I left a message in MyChart explaining I had called, I got a call back immediately. Also, I'm gonna say, make your own medical book. I'll show you how I did mine. The gaslighting is astronomical, which we all know, especially women, especially black women, brown women. We know the gaslighting is astronomical. But if you have proof, numbers, and your own record to show up with, it's much harder for them to gaslight you when you got receipts literally in your hand. So you want to make your own medical book. Mine a little thick. It's a lot happening over here. I digress. Yours probably won't be this thick, but what I started with, which I'll show you some little screenshots of it. So this book helps me keep track of my results, their notes, and my notes, which we talked about before, of how I was feeling, why I felt I was feeling that, what was happening in my life, all the things. Their notes on what they say, because I also print out the notes that they write in the system, because I want to know what you wrote in the system and what you're describing, because while some other doctors' offices can see those notes, when you go for, like, if you went to the hematologist, then you went to a general practitioner, sometimes if they're in the same network, they can see the notes that the other doctor wrote. Some of them cannot. But I also want to know how you describe me, because if it don't match how I think it should, I'm going to call and ask why, or send an email and ask why. I also make a list of questions I have for the doctor so that they have to answer it, and I take my clipboard with me so I can have just that one page, so I can put this back in the thing and then write down their answers to the questions that I have. And then I put that in the book, so then the next time I go and visit them, I take this with me, so that if I feel like the doctor is ignoring me, gaslighting me, or questioning my own feelings about my body that I live in 24/7, I pull out the receipts and I'm like, well, according to this test, and then we took the same test then, and then so what's your differential diagnosis? And if they say something, I'm like, well, on June 13th, you had answered this question by saying this. So they hate to see me coming with my book in my clipboard, but whatever. So these are the tabs that are in my medical book. The first, which I didn't make a tab for, which I probably should, is the primary doctors of care. This is any doctor who I see at least once a month. It's definitely if I see them once a week. They are the most up-to-date on what's happening in my health, so their information is always right there. Then also my blood work at a glance, so that any doctor can see, like, over the past 1.5 or 2 years, what my blood work has been looking like. Anyways, after that, it has my notes, which we talked about. Then the insurance. The insurance section has, like, all the times that I was denied and who I talked to and their phone numbers and their extensions, and then the acceptance letter and anything that happened after that. It also has my medical directive. Definitely set up a medical directive. That is for any time I go into the hospital and have any procedure done. It states who is in charge of me, who is to call in a state of an emergency, and it's been signed and given to every place that I have any kind of procedures. You want to do the same thing. Anyways, these are all the other type of tests and things that I've had done, and that's how I divided up my thing. So I can always look back on what was happening, how I felt, did it work, did it not work, what did that result say from that testing, and I always have something to refer back to. It helps you so that you don't feel so gaslit. Like, I was able to really notice, like, how much pain I was in, because I was able to look back over my notes and what was recorded. So make your medical book. It will be very helpful to you, especially if you have a lot of things happening. Definitely make a book. Even if you don't, your book can be small. Like the book I have for my kid is much thinner because he ain't got nothing happening. But at least we have a record. So no matter what doctor's office we go to, and if we change doctors, and if our network changes, or if our insurance changes, we have a record of what we've been through, what we've been tested for. If you have questions, reach out. I'd love to help you figure out how to divvy up your dividers for your medical book. Anyways, be well, be healthy, take deep care of yourself, because if you don't do it, ain't nobody else gonna do it.